Hi, I'm James, and this is my persuasive speech. I would like to begin by telling you all a story about a woman named Harriet Scott. She was one of the famous Death with Dignity Act participants. A wife and mother, she made sure that she stayed active at the gym with her friends. She never smoked, just lived a very health-conscious life. But unfortunately, at the age of 69, she was diagnosed with liver cancer. She battled it for 3 years before finally being given a terminal diagnosis and stating that there would only be about 2 weeks to 2 months left to live. At that time, she decided to take life into her own hands, just the way that she had always done, and she sought out a physician to get some physician-assisted suicide medication and end her life when she wanted. There are currently 9 states in the U.S. which allow physician-assisted suicide. All 50 states, however, do have a DNR. Tennessee specifically has what's called a POST form, which is a physician's order for scope of treatment. With this form, you can state whether or not you would prefer to have cardiac or CPR done on you in a cardiac arrest. So there's also the option for comfort measures, which means basically that you just stay where you are, receive pain medication and oxygen, limited intervention, so you can be intubated or have a feeding tube, and then full scope, meaning that you can just be treated like everyone else. So Tennessee currently, like I said, does not have this Death with Dignity Act law passed, and that is what I'm seeking to change. I've had the privilege of serving the community that I was born and raised in by working as an EMT on an ambulance. I've seen a ton of different calls, and one of the most common is a fall or just a minor trauma to a geriatric person. So at one of the assisted care facilities or nursing homes, there will be a packet of information in which that post form will be included. I always make sure to check it because it is the patient or the patient's family's wish for what should happen to that patient. I feel strongly that if the patient or the patient's family has expressed their wishes for something to be done, that needs to be followed. I actually have a testimonial from Mrs. Scott before she took the medication which ended her life.
Medication and where I might get this medication and that type of thing.
Some might argue that that's a pretty brave step to be contemplating that.
Really? I don't know. I don't think it's brave. I think it's realistic. I've spoken with people who think it's a really cowardly thing to do. So it's all of a matter. Everyone has their own opinion on whether it's right or wrong. I don't want other people making that decision for me. I want to be in charge of my own decision making. I don't think anyone has the right to tell me what I can or can't do.
Why should someone who is mentally fit and able to make their own decisions, someone who has been given a life-ending sentence of less than 6 months, why should they have to deal with the suffering if they don't want to? I believe that it's each individual's right to choose to die whenever they should choose. Why shouldn't that individual be allowed, why shouldn't that individual be allowed to express their right to life uninhibited by the opinions of another who has not ever been in that position? The Death with Dignity Act would allow these individuals the right to end their life in the way that they see fit. So some information about it. An adult resident, you have to be an adult resident of the state in which the law is in effect. Like I said, there are currently 9. You have to be mentally competent, which means that you can make your own decisions, that you're awake, alert, oriented to person, place, time, and event. You have to be diagnosed with a terminal illness in which you have less than 6 months to live, and that has to be verified by 2 physicians to ensure that it is truly a terminal illness. And you also have to be capable of self-administering and ingesting the medications without any assistance because it is the physician-assisted suicide. Some of the statistics that I have from the deathwithdignity.org is 2,216 people have received the prescription medication for the life-ending drug since its inception in 1998. Since then, 1,459 people have consumed the medication and went on to die peacefully. This is important because it shows that not everyone who's been given this medication or everyone who's been prescribed it ends up taking it. It's just that they want the option to choose when they should die. The American Cancer Society states that in 2019, there will be an estimated 14,840 deaths in the state of Tennessee alone just due to cancer. Cancer being the #1 reason for someone to get on these life-ending medications. Across the United States, there's to be an estimated more than 600,000 deaths due to various cancers. The most common symptoms that a person is going to experience is fatigue, pain, appetite changes, and difficulty breathing. Unfortunately, treating the pain causes more difficulty breathing, as you'll see in a moment, due to the testimony from a pharmacist. So the pharmacist's opinion from the British Medical Journal entry states that people are already dying through dehydration and starvation. They usually die within about 3 weeks, unless they're not getting fluids, and then it'll be a little bit sooner. He states that you can give IV medication and that you can give fluids, but that only prolongs an uninhibited life, basically, for the patient. And it goes on to state, like I said, about pain medication causing further respiratory depression. In conclusion, the Death with Dignity Act has been the saving grace for many people whom without this right would have had to experience a terrible end to their lives. All lives must eventually come to an end, but if avoiding the suffering is at all possible, then we should do everything we can to ensure that that happens. With the precedent set forth by other states in our country, I believe Tennessee can join in giving the freedom of choice to those who desperately need it. To support this cause, please visit the Death with Dignity Act homepage and petition for your local government to speak up on their behalf. deathwithdignity.org. Thank you.